A blessed day to everyone. On behalf of the principal author, Dr. Soledad Beloria of the Philippine Orthopedic Center, Quezon City, Philippines, and co-author, Dr. Maria Cecilia O. Martinez of the Pamantasan ng Lungsod ng Maynila College of Nursing, I, Dr. Jennifer P. Reyes, also from the Pamantasan ng Lungsod ng Maynila College of Nursing, Manila, Philippines, is grateful and honored to present our paper entitled Nurses' Knowledge and Skills in Safety and Quality Care for Patients with Spinal Cord Injury. To begin with, safe and quality nursing care has been increasingly in focus during the past 10 to 15 years. As provider of direct patient care, nurses hold a central position in inpatient hospital care, especially for patients who have decreased or absence of movement, sensation, and body organ function, which occur because of compulsion, incision, or contusion caused by the spinal cord injury or SCI. The damage to the spinal cord can be prostrating and have a catastrophic impact on the patient, such as varying degrees of paralysis depending on the level of injury, loss of motor and sensory reflexes, which also include bowel, bladder, and sexual dysfunction. Most spinal cord injury result from direct trauma to the vertebral column. It affects the spinal cord's ability to send and receive messages to and from the brain. The disruptions impair the system that controls sensory, motor, and autonomic functions below the injury level. Functions lost usually stems from a contusion or compromised blood flow to the injured part of the cord, such as from subluxation, fracture, dislocation, and hyperflexion or extension injury. The result of SCI, according to Alisadi et al., bring not only damage to independence and physical function but also include many complications from the injury. It could even lead to serious disability for the patient, resulting in the loss of work, which brings psychosocial and economic problems. It takes a long period for its treatment and rehabilitation, which is also expensive and exhausting. This study utilized the sequential explanatory mixed method research design to determine the knowledge and skills of nurses in the provision of safety and quality nursing care to patients with spinal cord injury as the basis for enhanced training intervention programs. Data gathered were validated by 2 experts in nursing and 1 expert in psychology, and reliability tested using Cronbach alpha coefficient analysis. Frequency, percentage, weighted mean, ranking, Mann-Whitney, Kruskal-Wallis, and Spearman-Rowe were used for the statistical treatment. To determine the problem encountered by nurses in providing safe and quality care to patients with spinal cord injury, structured interview were used and then subjected to LISI data analysis method. Lastly, ethical and legal aspects were considered during the data collection. For the result, first, the nurse's knowledge in providing safe and quality care for spinal cord injury patients. Proper positioning, turning, and lifting. Table 1 presents the level of knowledge of the nurse respondent in providing safe and quality care as to proper positioning, turning, and lifting with an overall mean score of 3.76, interpreted as extremely knowledgeable. This finding can be attributed to the fact that all the items listed in the table above are visually posted around the department. In addition, the signages about the schedule of positioning, turning, and lifting is also visually posted around the ward. This finding is supported by the works of the American Nurses Today in 2016, which stated that competent care for persons with spinal cord injury is necessary to address and prevent complications associated with SCI. Respiratory care. Table 2 displays the level of the knowledge of nurse respondent in providing safe and quality care as to respiratory care with an overall mean score of 3.74, interpreted as extremely knowledgeable. With this level of knowledge, the nurse respondent were equipped to handle patients with spinal cord injury in terms of respiratory care. Skin care. Table 3 showed the level of knowledge of the nurse respondent in providing safe and quality care as to skin care with an overall mean score of 3.75, interpreted as extremely knowledgeable. This finding means that the nurse respondent knew that the skin of a patient with spinal cord injury is vulnerable to skin breakdown and that loss of sensations to hot or cold temperature and pain below the level of injury can happen if they do not know how to take care for them. Bowel care. Table 4 illustrates the level of knowledge of nurse respondent in providing safe and quality care as to bowel care with an overall mean score of 3.53 interpreted as extremely negligible. This finding means that the nurse respondent knew that damage to the spinal cord has a great effect on the functions of the large bowel, such as that loss of sensory and motor function will cause an individual to have bowel elimination problem, and that prolonged constipation, if not properly addressed, will expose the patient to secondary complications which might aggravate patient's health condition. Bladder care. Table 5 displayed the level of knowledge of the nurse respondent in providing safe and quality care as to bladder care, with an overall mean score of 3.59 interpreted as extremely negligible. This finding means that the nurse respondent knew that during post-spinal cord injury, the normal functions of the urinary systems may be affected. Preventions of complications. Table 6 shows the level of knowledge of the nurse respondent in providing safe and quality care as to prevention of complications, with an overall mean score of 3.52 interpreted as extremely negligible. This finding means that the nurse respondent knew about how to prevent complications of the spinal cord injury. Next is the nurse's skills in providing safe and quality care for spinal cord injury patient. Proper positioning, turning, and lifting. Table 7 present the extent of practice of the nurse's skills in providing safe and quality care in terms of proper positioning, turning, and lifting, with an overall mean score of 3.71 interpreted as very high extent of the practice. This means that the nurse respondent have been practicing their skills in proper positioning, turning, and lifting. This skills is a type of pressure injury prevention strategy and is a primary role of nurse in preventing pressure ulcer. The implication for this is that patients with spinal cord injury will feel comfortable and can be encouraged to cooperate in their treatment regimen. Respiratory care. Table 8 display the extent of the practice of nurses' skills in providing safe and quality care in terms of respiratory care, with an overall mean score of 3.64 interpreted as very high extent of practice. This means that the nurse respondent have been practicing their skills in respiratory care. This is traced from the fact that nurses need to stabilize the airway of their patient as a priority management intervention. This is because spinal cord injury patients are highly vulnerable to respiratory distress and pulmonary embolus due to aspiration or decreased innervation of the diaphragm and altered functioning of the intercostal muscles. Skin care. Table 9 shows the extent of practice of the nurse's skills in providing safe and quality care in terms of skin care, with an overall mean score of 3.61 interpreted as a very high extent of practice. This finding means that in terms of skills or doing tasks for the prevention and management of pressure ulcer or sore, the nurse respondent have been well practiced. Bowel care. Table 10 illustrates the extent of the practice of the nurse's skills in providing safe and quality care in terms as of to bowel care, with an overall mean score of 3.49 interpreted as high extent of practice. This finding means that the nurse respondent practiced the skills in providing safe and quality care in terms of bowel care, but not to the greatest extent. This has the same rationale as to the skin care in the genital area, where nurses prioritize other complex needs that patient with a spinal cord injury must be addressed, which is detrimental to the quality of life of the patient. Although the nurse respondent have extreme knowledge as resulted in Table 5, they knew that damage to the spinal cord has a great effect on the functions of the large bowel, that loss of sensory and motor function will cause an individual to have bowel elimination problem, and that prolonged constipation, if not properly addressed, will expose the patient in secondary complications, which might aggravate patient health condition. The extent of practice of the skills about it was not that great. This means that it is not a priority assessment done by the nurses with their patient with spinal cord injury. Bladder care. Table 12 shows the extent of the practice of nurses' skills in providing safe and quality care in terms of bladder care, with an overall mean score of 3.69 interpreted as very high extent of practice. This indicates that the nurse respondent performed their tasks about bladder care to their patient with spinal cord injury, such as intervention to facilitate urinary eliminations and prevent other complications. The table also presents that almost all items under this table are rated as very high extent of practice. This is because bladder care is a routine task done to patients with spinal cord injury round the clock at the Philippine Orthopedic Hospital, as verbalized by the nurse respondent. Preventions of complications. Table 13 displays the extent of the practice of the nurse's skills in providing safe and quality care in terms of preventions of complications with an overall mean score of 3.53, interpreted as a very high extent of practice. The findings depict that the nurse respondents are well skilled in the art of preventing complications for their patient. With this kind of practice, these nurses can recognize the unique need of their patients, like physical, psychological, socio-economical, and implement interventions to maximize patient's outcome. Based on the aforementioned result, the following conclusions were drawn. Most of the nurses respondent belonged to the young populations. They were educated with bachelor's degree and had been in the service taking care of patients with spinal cord injury for 1 to 5 years, which have them made them attended training seminar relevant to it. This study also concluded that the nurse respondents are extremely knowledgeable in providing safe and quality care in terms of proper positioning, turning and lifting, respiratory care, skin care, bowel care, bladder care, and preventions of complication. Has a very high extent of practice of the nurse's skills in providing safe and quality care in terms of as to proper positioning, turning and lifting, respiratory care, skin care, bladder care, and preventions of complication, and a high extent of practice for bowel care. For the limitation of the study, the findings of this study must be treated with caution and may vary in other areas of the Philippines. This study only included the population of nurses at a level 3 tertiary hospital of the Department of Health. This study was based on the self-report of the nurses. After analyzing the result and upon evaluating the aforementioned conclusion, the following recommendations are given. Nurses to become aware and identify the gaps in terms of their knowledge and skills, as well as problems that confront them and their patient in terms of provision of safe and quality nursing care. Patient with spinal cord injury to trust their nurses, especially in taking care of them as they will undergo enhanced knowledge and skills for them to be able to cope while being taken care of in the hospital or even they were discharged already. Hospital administrator to use the findings of this study as a basis to evaluate the contributions of their nurses' performance, their knowledge and skill in providing safe and quality care for SCI patients to the achievement of their organizational goal. Nurse serving administrator to consider reviewing guidelines and policies on identifying and assigning nursing personnel in the ward clinical area to take care of patients with spinal cord injury. Nurse supervisor to always identify the strength and weakness of each nurse under their supervision and determine if the standard of safe and quality patient care are being complied with or being satisfied according to the needs of their patient, especially those with spinal cord injury. Nurse trainer to frequently identify the training needs of nurses so they can evaluate their learning and plan a development program to align it with the strategic directions of the organization and to address the need of its personnel and stakeholder. The Department of Health to use this study as an assessment for the technical assistance needed by the healthcare provider and considered increasing the budget allocation for tertiary health care agency that provide care to the patient with spinal cord injury to meet the costly hospitalization and future researcher to use these studies as a resource material and basis for future researches. Before I end up my presentation, I would like to acknowledge and present the following references used in the study that guided our research. With that, I thank everyone for listening. Thank you very much and have a blessed day to all.